Berapa orang
12 doktor.
Ya.
Yes.
Group Y3 berapa orang?
36 all.
36 ya.
Yes.
Mana yang lain? Hanis, Abdullah Hakim.
Switch on camera.
Ada doktor.
Hanis Syamimah mana? Hanis Kaudi mana?
Ada doktor. Kejap.
Siapa present?
Me, doctor. Amina. Me.
Apa? Aminah?
Yes, doctor.
Kes apa you punya?
Sorry.
What case do you have?
Kawasaki disease.
Nama, chief complaint, age. What do you mean?
Okay, I'll start presenting.
Not presenting, introduce your patient.
Okay.
Your patient
So
bukan
my
kayu
patient,
ni
my patient is Muhammad Hadas, 1 year, 8 months old Malay boy. He presented to Hospital Pekan due to unresolving fever of 6 days duration.
Dia tak ada, chief complaint saja, fever for how many days?
Associated with reduced oral
Listen
intake.
to me.
Yeah.
Chief complaint only one symptom. What is chief complaint?
Persistent fever.
Fever for how many days?
6 days.
Present again.
Muhammad Hadas. My patient is Muhammad Hadas, 1 year and 8 months old Malay boy, who was referred to, who presented to Hospital Pekan due to persistent fever of 6 days duration.
Enough.
Okay.
Any other apa tu? Any other case? One case only. Zuri ask prepare 2 cases kan?
We prepared 2 cases, doctor.
Who else?
Yes, me doctor. Second.
So about to introduce your patient.
Okay. My patient, Faiz, 8 years old Malay boy, complain with right swollen neck for 5 days duration and fever for 8 days duration.
Right swollen neck.
Yes.
Right neck swollen ke Swelling at the right neck ke, mass ke apa?
Swollen at the right neck.
For 5 days.
5-day duration and fever for 8 days duration.
Swollen of, macam mana nak sebut betul sikit English tu?
Enlarged
Swollen right neck.
right swollen neck.
Bengkak, swollen. Tak tahu macam mana. Progressive
Right
tak
neck
progressive? Progressive.
Yes, progressive. Progressive increase.
Aminah, present.
So Muhammad, a 1 year and 8 months old boy, was referred to Hospital Pekan by Klinik Kesihatan due to unresolving fever of 6 days duration. So upon further questioning, we got to know that Muhammad was well until 6 days ago when he developed a fever. No more details about the fever are given. The mother noticed that his lips were dry and cracked, and she also complained of him having reduced oral intake and being irritable. On the third day of illness, his mother noticed progressive swelling at the left neck region, which was tender to touch.
Swelling of what?
At the left neck region, swelling of the neck. He also developed a chesty kind of cough and runny nose. The next morning, the mother brought Muhammad to Klinik Kesihatan Ramping, where he was prescribed with antibiotic and antibiotics. On that evening, Muhammad developed rashes, which prompted his mother to bring him to Hospital Ramping. The rashes began at the abdominal area, spreading proximally, and was described as reddish, some raised, non-vesicular, and not itchy. His mother was not sure if the rash blanched upon pressure. At Hospital Ramping, he was prescribed with cefuroxime, and he was not hospitalized. On the 5th day of illness, Muhammad had an episode of vomiting after drinking milk, and also an episode of diarrhea where the stool was green with a liquid consistency, Bristol 7. He also had another episode of diarrhea of the same kind the next morning. The next day, his mother brought him again to Klinik Kesihatan due to persisting symptoms, and he was referred to Hospital Pekan for suspicion of Kawasaki disease. On that day, his fever was still unresolved, and he had developed a pink eye that was not associated with any discharge or pus. He also had developed swelling on his hands and feet on both sides, and his mother noticed peeling of the skin at his right thumb. His mother also complained of him being lethargic and less active. Upon further questioning, the patient denied any history of traveling, water activities, or fogging around his living area, and he did not have any history of sick contacts either. Moving on to the systemic review. For the cardiovascular system, he did not complain of any shortness of breath, cyanosis, chest pain, reduced exercise tolerance, or fainting episodes. For the respiratory system, there was no wheezing, fast or noisy breathing, and the GIT, there was no abdominal pain or distension. Genitourinary system, there was no change in urine frequency or change in the color of urine. And for neurological, there was no fitting episodes, impaired movement, or change in his behavior. Musculoskeletal, there was no joint pain or gait abnormality. Moving on to his past medical history, he has been hospitalized 3 times before this. The first hospitalization occurred when he was 3 months old. He was admitted to HTA for 3 days due to intussusception. And the second hospitalization was when he was 5 months old, when he was admitted to Hospital Ramping for 3 days due to dysentery, which presented with blood streaked stool with mucus. The third hospitalization happened when he was 8 months old. He was admitted to hospital Rompin for 7 days due to bronchopneumonia, and he was given antibiotics and nebulizer without any intubation. He has no known drug or food allergy. Immunization was completed as scheduled, and up to his age, he had no allergic reaction after vaccination, and he has not been given any additional vaccines. His birth history was mainly uneventful. Antenatal, there were no antenatal, interpartum, or postnatal complications. He was born at term at 40 weeks via SVD with a birth weight of 3.3 kg. Postnatally, he had neonatal jaundice for 1 day, but he was not admitted and he did not receive phototherapy. For nutritional history, Muhammad was exclusively breastfed for the first 3 months, and then he was fed with formula milk ever since. He usually has 6-ounce milk 7 times per day. He started weaning at 6 months old with porridge. He was not a picky eater, but he ate less vegetables. As for developmental history, for gross motor, he is able to run and walk up and down the stairs with help. Fine motor, he has a neat pincer grasp. Speech and language, he knows and responds to his name and can pronounce 1 to 3 words with meaning. For social development, he uses his spoon. He can use a spoon well, and he assists with dressing himself. Moving on to the family history and social history. Muhammad's father is a 36-year-old man with no known medical illness, working as an operator. His mother is a 34-year-old woman with no known medical illness, working as a staff nurse at Klinik Kesehatan Rompin. The household income was around RM4,000. And when both parents were working, Muhammad was sent to the babysitters where he was with 2 other kids who were well and didn't have any symptoms. He was the 3rd child out of 3 siblings, and both of his older brothers were alive and well with no known medical illness. The family of 5 lived at Romping, where it took 5 minutes to the nearest healthcare facility. Okay, shall I proceed with the physical examination, doctor?
Ini siapa kelak the history?
It's not me. It's
Huh?
one of the seniors.
I don't know what apa benda you all belajar, tapi what to do. Ikwan, any question to ask?
I would like to ask, as you mentioned that this patient developed the rash, does the rash is developed upon administration of the antibiotic tried at the kekirompin?
No, the rash occurred before he went to the clinic. It was on the, no. It's just mentioned that on that evening he developed rashes. It could be due to the antibiotics, but yeah, not sure.
Do you notice there's any presentation of strawberry tongue?
No, there is no mention of any changes on the tongue. It's just that the lips were dry and cracked.
Okay, thank you.
Nabila?
I would like to ask about any tonsillitis symptoms, like sore throat, difficulty swallowing.
No, there's no mention of that either. Sorry? No, no mention of sore throat symptoms.
Rukniah.
I would like to ask the characteristic of rash. Is it maculopapular or is it exanthema?
Maculopapular. That's,
Nabiha.
As you mentioned before, that the patient has swallowing in the hand and feet, right? So, is there any erythema also at the palm and the sole?
not mentioned, only the swelling.
Okay.
Aida.
I would like to ask, is there any rodent infestation at the patient's home or maybe the daycare?
Sorry?
Is there any rodents infestation at the home or the daycare?
No,
Huh?
no,
No, ke don't know.
don't know.
Afiq.
I would like to ask about the nature of the rash. Does the rash looks like sandpaper rash? Is this cause?
Sorry, what rash?
I would like to ask more about the rash. Does the rash looks like sandpaper rash?
Oh, no. It's just
Abdullah.
I would like to ask about the vomiting. Is there any known volume for the vomit test?
no, there's no details about the vomiting.
Anis.
Ask about the characteristic of the fever. Is it associated with chest and rigor? And then if the mom documented the temperature at home for the fever.
There's no details about the fever.
Pardon?
There are no details given about the fever. It's just
Shamina.
I would like to ask, is there any complete spots that you could see at the buccal mucosa?
no, I mean, it's not. Later on in the exam, they mentioned that there is no complex spots.
Anis.
I want to ask if there is any skin peeling or discoloration or rash at the perineal area.
Perineal, not mentioned. And not noticed subsequently either.
Boring is it? Cannot go because you don't know the case. I don't know what to discuss when the presenter doesn't know the case. Because how to go about where the presenter doesn't know the case. Very difficult. Amina, you're talking about fever. Tell me what the thing you want to know about the fever.
So
If you are the one who clerked the case.
Yes, so I would be asking about the pattern of the fever, whether it's at a persistent temperature the whole time or it's on and off pattern. I'd ask if it's associated with chills and rigors, and if it's worsened by like at night or anything causes it to worsen, or if it's relieved by say paracetamol or sponging, yeah, relieving and whistling factors, and yeah, if they documented any temperature at home.
Ikhwan, if you want to know about the rest, what do you want to know?
Sorry. Okay, so for the rest, I would like to look for the morphology or the characteristic of the rash first. Is it flat or raised? Or and other things I want to look for the constituency of the rash, whether it is pus pale or solid nodule or maybe liquid pale, such as bulle, and also if um, if there is skin bleeding such as petechiae or purpura or ecchymosis, yeah, that might suggest many of differential diagnosis of the rash.
Itu je.
Yeah.
If you want to add anything.
I can also ask about where the progression of the rash. Where does it start first? Is it from the extremities or from the central?
Why?
For example, if it start in the extremities, we can one of the diagnoses can be hand, foot, and mouth diseases. If it start from the trunk area, it can be caused due to Kawasaki, scarlet fever, measles. So that's why important to know where does the rashes start first.
No. What you want to know about the
rash, Doctor? I would like to know more about if the rash worsens at night, for example.
Rash worsen at night. Rash apa worsen at night?
Scabies.
Scabies worsen at night.
Yes.
Huh? Scabies worsen at night. The rash.
Yeah, I read somewhere it wasn't at night.
It was more noticeable, more itchy at night. But the rash worsen.
Not. Oh, okay. So it's not worsen, but noticeable, right?
Rash pun tak boleh discuss. Aduh. Dunia.
Is it about the rash?
Rash. Tak habis lagi rash. Tak boleh nak describe. What do you want to know about the rash?
Is it the color is uniform or patchy or blotchy? The color. And then like previously Faiz explained about progression. However, we need to know where's the location first. Is it generalized or localized rash? And then the texture itself, Doctor. The texture.
What?
Like, is it the rash is scaly or is it smooth surface?
Lagi?
Itchiness.
Lagi?
Tender. Is it?
Lagi?
Okay, is the rash associated with soreness? Like if the rash is at the area of the joint, it may due to the joint pain, related to the joint pain.
Lagi?
Yeah.
Tu je.
I'm not sure about I'm not sure about this.
Sunburn light. Betul?
Belai. Tak tahu kenapa payah sangat. When it start, how it start, shape, size, color, raise, not raise, margin clear or not, discharge or not, itchy or not, blanching or not, progression. Tak tahu kenapa payah sangat you all ni. Simple je. Vesicle or not, wet or not. Basic je benda tu. Basic thing pun tak boleh nak explain. Things are very clear. Ni tak boleh nak explain. You still unable to know, let's say, if it's a skin condition, what is it you need to know about the skin condition? Of course, you want to know about the shape, the size 1 millimeter, 1 centimeter. Susah sangat ke? Tak boleh ingat SSS, shape, size, color. Nabiha. Generally, the chart is how you define it on history. Ill, well, unwell, not well.
I think he was unwell.
Tak dengar.
I think because he is unwell.
Why you say unwell?
Because
Why you don't say it's ill?
There are no any signs of shock yet.
Apa do we talk about signs? We talking about symptoms.
Okay. I think because I see he was unwell because he still can he still not have the toxic looking.
Ayahnya lah cakap dengan you ni. Do we talk about sign or not?
No.
We stay on history, tahu tak? Your kawan you tak cakap about toxic looking. Do she mention about toxic looking or those things?
No, doctor.
We're talking about history. Usually, you know why I don't like to go through until the physical examination. Most of the time, physical examination and history doesn't synchronize very well because you only examine after 2 or 3 days after the child being admitted. That's why you notice I don't go for physical examination so much. Because it give you a wrong ideas. Because most of the time the examination you all done is 2-3 days the child been admitted. As a result, history and physical finding didn't tell you very well. Confuse you all more. The good case is the case you get the case and you on the day of admission and you present throws. And then you can find the synchronize between the physical examination and the history. Now we're talking about the history. What your conclusion about this child when you listen to the history?
I think I think she was unwell.
Yeah, but
Because
you must, why you think it's unwell?
because of the unresolved fever.
Huh? Because of
Due
the
to the unresolved fever.
you unresolved fever tell you that unwell. Hmm?
And
We do what we know about fever? The fever high, moderate, or low?
Nothing.
Ah.
We do not know about the fever. The irritability, because
lagi?
the patient also come with irritability, and also patient also have
Aida?
poor oral intake.
Aida?
Yes, doctor.
What your opinion?
I think the patient is probably having dehydration because the patient has.
What's your opinion? How patient condition?
She is probably unwell
Okay, why?
because of the irritability as well as the dehydration
Your friend
symptoms.
mentioned dah.
She also has a reduced oral intake.
Lagi?
He also
How reduce is reduce?
reduced oral intake.
How reduce is reduce? You rasa orang ill pun dia very unwell, yang ni pun tak minum ke?
The presenter didn't mention regarding that.
Afiq?
Yes, doctor. So in my opinion, the patient is unwell because the patient also has a chesty cough and runny nose.
You mean well patient pun tak dapat cough and runny nose?
Patient is also
Kalau
appear
ill patient pun tak boleh buat dapat cough and runny nose.
your patient still can have cough and runny nose also.
Why do you think patient is ill?
Because the patient has diarrhea and vomiting.
I mean the patient ill pun cannot get diarrhea or vomiting. Abdullah?
In my opinion, the patient was unwell because he complained of lethargy.
Kenapa dia tak treat dekat rompenya?
Sorry?
Kalau dia unwell, just unwell, not ill, kenapa dia tak treat kat rompen saja?
Because the medication was not responsive. He was not responsive to the medication given.
So, because of not responsive for medication, then they send to pekan.
Because the disease is still progressing, in which he developed diarrhea and vomiting, and the fever is still unresolved.
So, AGE je kan? In that case, diarrhea vomiting AGE je lah. Kalau AGE kenapa nak hantar ke pekan? Anis,
Yes, I think, well, since you've mentioned all of that just now, maybe the child is actually ill. That's why the
why
the doctor in
what from the history, why you think the child is ill?
because he is lethargic, and then also is stated with the vomiting, the rash, the prolonged fever.
Is it the rash tell you the severity? Oh, ramai ya orang ada measles, chickenpox, ada rash. Kita tak masuk ward pun. Stay at home. Ramai budak diarrhea, vomiting, kita treat at home je, tak masuk ward pun.
Maybe because the presence of all of the symptoms at the same time.
If what kind of diarrhea, then you need to admit to the ward.
When the child present with dehydration.
Dehydration. There are many dehydration. Mild, moderate, severe. Yang mild tu kita masuk ward ke?
Tak.
Ah.
So severe dehydration. When the child have severe dehydration.
In this case, you know not.
In this case, we do not know.
Then why you say they have diarrhea? In that case, you mentioned diarrhea. You teacher is ill already, but you don't know how severe the diarrhea is. Do you know how severe the diarrhea is?
I just know that characteristic of the characteristic of the stool.
The characteristic of the stool tell you how severe the diarrhea is.
No, it does not.
Shamina?
I think the child is ill because he had progressive in illness, and also the symptoms, I think it is involving many systems. Like the symptoms progressive, and also it like systemically affected, because patient present with skin lesion, and then neck swelling,
neck swelling is sign of severity. Neck swelling tu sign of severity lah. Anis.
I think he is unwell because after the medication, the fever still because after the medication at the clinic Rompin, the symptoms still did not resolve, and then after that he also have some symptoms that affect other many symptoms, systems such as GIT, vomit and diarrhea, and then he also have rash, and then also become lethargy.
Ask you, why the chicken pox rash tu banyak tak masuk ward? Banyak rash. So you say is need to be admitted because of the rash.
Doctor, is it because all the symptoms such as that it is Kawasaki and the complications Kawasaki is very insidious, hence we need to hospitalize it?
Okay, that, probably that you can argue on that why the child need to be referred. The child need to refer because they worry of the Kawasaki, which the district hospital unable to manage. But the next question I want to know how ill the child is. The reason the child be admitted not because of unresolved fever, because they thought that the child is having Kawasaki need a further management. But when the child reached to the hospital, Pekan, how ill the child is? How you want to know the child is ill, unwell, well? What parameter you can say that decide this child is ill? What parameter you can say just unwell saja? Which parameter? Can you say rash? You say rash, I can say there were so many missiles, kita tak admit dalam ward pun.
Is it based on the vital signs, doctor?
Huh?
Based on the vital signs or from the history still?
You see, when the patient come to ED, the first thing we look at the child, we already decide the child is how ill the child is. Even without doing the sign already, we can decide how ill the child is.
Mental state.
Lagi?
Is the child conscious or in comatose state? Cyanosis.
Maybe, tapi this is not respiratory problem.
It could be cardiac complication.
That one or sign. Okay, like mental state is one thing. The child is active, alert, lethargy, coma, drowsy. Anything else? Kalau tak pergi ED, tak jadi macam ni. Boleh, you are unable to visualize how, if the child is ill, how the child going to look like. If the child is not that ill, how the child going to look like. The child is relatively well, how does the child look like? The child can walk, walking, running. Somebody had to unable to walk, very weak, lethargy. It cannot. Tapi the problem with you sometimes good you tengok cerita movie berkaitan dengan medical ni. Kalau you tak tengok pun dalam apa tu, the real life, there are many movie about medical tau. Yang pasal ER everything semua, all this cerita can give you some ideas how to decide how bad the child is, especially cerita Mak Saleh. Ingat je cerita Melayu. Cerita Melayu ni maknanya cerita Melayu ni dia kisah pasal cinta je, bukan kisah pasal pesakit. Nothing else. So, hospital pun nak bercinta, dekat tu pun nak bercinta, dekat IR pun nak bercinta. Tu cerita Melayu, tengok cerita Melayu otak you tak berkembang. It's not about the patient and disease. Life dia, hidup dia itu bercinta je. Even Korea film sekarang dah bagus dah. Welcome to cerita medical ni. Involve ethical issue also. Because it give you some ideas, imagination, to create imagination inside your brain now. How bad the child is. Because you are unable to come to ED because of this COVID, everything semua. Perhaps you go and look cerita ER, everything. This give you some ideas of how patient is, how you decide person is ill not ill. Because this all need creativity and imagination. Very bad lah you all. Even you cannot describe the child is ill not ill. So you see how superficial you all is. Unable even to describe how you define patient is ill, patient is not ill, patient is unwell. Tak boleh nak describe. Got all this imagination. Tapi yalah boring sebab I boring mengajar sekarang. Sebab mengajar kes you all tak kelak very boring. Because I tak pernah pinpoint your problem. Examination, Aminah.
Alright, so for so for general examination, Muhammad was alert and conscious. He was not in tachypneic and not in respiratory distress or in any pain.
Usually I would like if examination you mention how many days after the child been admitted.
Yeah, it's
so it give you some ideas of, because most of the time I'm worried. Many of the time, many times, the problem is that your history and physical examination didn't synchronize. The child is irritable dalam history, but if physical examination, child is alert and conscious, playful, well. Of course lah, if you examine the child 3 to 4 days after the child was started with treatment, especially the aspirin or immunoglobulin, of course the child become well after that, fever resolve. So I found out it doesn't give a good, it give you a bad impression about how to tally the history of physical examination. You see the physical examination, child is tachypneic, but in the history, child is tachypneic, but physical examination, the rate is normal. Why? Because you are examined 2 days after the admission. So because you lost the importance of physical examinations, whereas physical examination is part of the clinical finding. I never have this kind of problem, during my time, because most of the time we clerk the fresh case, we present the fresh case. When the child is admitted, patient admitted to the ward, pagi, petang tu we already clerk already. And then we present already that case. I don't know. Apalah, because things have changed now. Okay, Han, present now.
So the examination was done on the 11th day of illness.
The 11th day of illness. So what's there to find? Okay,
Okay, so there was a cannula attached to his left foot with no active infusion. On examination, there was on inspection, there was red fissured lips, bilateral hands and feet edema, and desquamation of the right thumb. There was also a left cervical lymphadenopathy noted, and the lymph node mass was movable. There was no pallor, clubbing, cyanosis, signs of jaundice, or radiofemoral delay. The hydration stages was good.
What lymph node mass? Apa dia kata?
Lymph node mass was movable.
Is that how you present lymph node ke?
No. So if you're presenting on lymph node swelling, you start with the site, the exact location, the size, the temperature, tenderness, and also the surface, whether it's irregular or smooth, consistency. You'd also check for fluctuation, transillumination, and mobility, and
Okay, continue.
So the vital signs are all normal on this day. The anthropometric measurements, the weight is 11.56 kg. The height and circumference of the head are not recorded. The cardiovascular system, on inspection, there was no apparent precordial bulge, no visible apex bead, and no surgical scars. On palpation, the apex bead was in the fourth intercostal space at midclavicular line. No thrill or parasternal heave. And an auscultation, the first and second heart sounds were heard with no murmur or additional sounds. So the cardiovascular system is normal. The respiratory system is also normal. The abdominal examination, it was also normal. Shall I go to it, or okay, it's normal. And for the nervous system, there was no muscle wasting, involuntary movement, fasciculation, or tremor. Tone was normal and power was at least 4. Tendon reflexes were normal and equal bilaterally. Shall I move on to the case summary? In summary, Muhammad, a 1 year and 8. Skin.
Skin finding. Any skin finding?
It's not there under the physical examination.
Ikhwan, when you listen to the history, what the physical examination you expect to find?
For the Kawasaki disease, berarti.
You dengar apa balik? You dah listen the history dah tadi.
Yeah.
Panjang history dia listen tadi.
So
what physical finding you expect to find?
Expected finding, I would like to find in this patient that have
You
present.
dah listen the history tadi kan?
Yes.
What physical finding you expect to find from the history you listen just now?
He has
very poor imagination.
Red fissured lips, and
dia mention tak dalam
also,
history dalam history tadi ada mention tak?
Yes. Yes.
We start general examination tak?
Okay, so from the general examination per inspection, so this patient might on face examination, this patient might have red or fissured lips, and also on the neck there is.
Faiz, can you do better than that? General examination.
General examination. Maybe the patient is already an 11-day illness, so maybe.
You listen the history already. You dah dengar history tadi kan? What you expected to find from general examination?
Conjunctivitis, can I expect? based
You
on the
to present
patient.
examination conjunctivitis ke? What you present first, patient you present, what the thing you present first and general examination? Conjunctivitis straight away.
The the appearance of the patient.
What you expected the appearance of the patient?
Can dia lying comfortably, I expect the alert,
Mental status.
cautious, then check if the patient is any sign of distress, such respiratory distress.
You dah dengar the history, you dah dengar the history, you create something else lagi. You dah dengar the history kan tadi? Nabila?
As for the general appearance, I would expect this patient to be alert and conscious, and then not tachypnea and also not in respiratory distress. Patient is also.
Iyalah. Ni?
I would say at general appearance, the patient may appear restless, irritable,
Lagi?
and also lethargic.
Lagi?
Okay. And from dry lips.
Because the child is intolerant feeding dan diarrhea. Tak boleh fikir, tak boleh imagination lalu. That's why you all teruk pemikiran you all ni. Lagi?
And then on the neck examination, I would say there's
Face tak habis lagi.
Oh, face tak habis. Redness of the eye.
You dah dengar history. Ada ke tak ada dalam history?
Ada.
Dah tu?
Non-purulent conjunctivitis.
Lagi?
Okay, and then
Setting you dengar history tadi, tak apa benda yang you dalam masuk dalam kepala otak you all. Ada lagi kat face kan? Nabiha?
The patient also might have fissured lip and dry lips.
Lagi? Itu je, colour dia?
A color because it was irritable. He was pink.
Pink colour lip dia tu?
Oh no, it was red, erythematous. It's erythematous lips and dry. Because fissured, it might have some bleeding. Because it was fissured, it might come with bleeding. And then because he also have a runny
expect to
nose.
find dalam physical examination di sini ni?
Still in general, doctor?
Ya dah, tak kira lah. You dah okay lah, you can go dah further.
Okay, go further. Okay, on the neck examination, there will be tender left neck swelling. And then
Where you think want to be?
Maybe at the anterior cervical triangle.
Lagi?
Left anterior cervical triangle. And then neck. And then we move on to the.
Is it mobile, not mobile, tender, not tender, metal or not?
I think it will be tender. Usually for Kawasaki it will be non-tender. But based on history, it was tender, and it was
Aida?
it was
Aida, anything else you think you should, when you listen these three, what the finding you expect to find?
I expect to find rashes on the patient,
On the,
polymorphous rashes on the trunk of the patient.
what kind of
Polymorphous
rashes you
rashes.
expected to find?
Some would be red,
Some other
wrist,
blue.
some would,
Yeah, some other blue, lagi some other yellow.
no, I'm sorry. It will be reddish, and then some would be wrist, and some would be flat as well. It will be non-vesicular.
How you know non-vascular? Okay, lagi?
It is non-itchy.
Lagi?
And also no discharge would be seen from the rash.
Okay. You what else important thing? You is vascularity or not? Afi, what else you can find?
So for the rash, I would expect that the rash would be non-blanching on pressure, and then
Non-blanching. Kalau non-blanching, vascularity lah. You mean vascularity rash?
yes.
Blanching or no blanching? In Kawasaki.
Non-blanching. Non-blanching.
What is different from blanching, non-blanching?
Refer if non-blanching, we to take pressure on the rash, it will not disappear.
So it means what?
It means that the rash is a hemorrhagic rash.
You think Kawasaki like that? You think Kawasaki develop to vascularity lesion all over the body?
Yes, vascularity.
Amina, what do you read? Blanching, no blanching, Kawasaki?
Blanching?
When you read last night about Kawasaki, is blanching, not blanching?
Non-blanching. Not blanching?
You read, it told you not blanching.
Yeah, I just remember that scarlet fever is blanching.
My question is that you yang teka. My question to you, do you read last night about Kawasaki or not?
Yes, I did.
Do they mention about the rash of the Kawasaki? Is it vascularity rash or non-vascularity rash?
It's not vesicular.
It's not vesicular. Why non-blanching?
Wait, did you say vasculitic, doctor?
If
I'm sorry,
vascularity, if it is vascularity rash, why is it disappear after a few days? You do you all know Kawasaki going to presented today? Any of you know about this thing? Tak tahu. When you come here, you blind saja dalam dia ni. How long you want to read about Kawasaki? 1 hour, 2 hours, 3 hours. You expected what? We give you spoon feed about Kawasaki. My job is to teach you how to diagnose Kawasaki, not the other things. Your job is to read about the Kawasaki and the differential. If you don't read about Kawasaki, it's your problem, not my problem. Your job is to read. My job is to make you recognize it is Kawasaki, not something else. What, you think of my job to teach you about Kawasaki? If you know already this case, 2 cases as to prepare, you already ask your colleague. Kita orang dulu kan tak ada WhatsApp, tahu tak? Tapi we already know your colleague want to present what case. Then we already read. And the presenter, the one who going to present, going to read, even 1 day, 2 days before to present, they're going to read already about the Kawasaki in detail. That's how we prepare our case last time. So discussion will become very enjoyable. We know about the facts. You know about the facts, we can discuss nicely. Abdullah, anything else you expect to find when you do the physical examination? When you listen to the history just now, when Minah present history. I don't want what happened 11 days. Will you expect
I would like to.
you expect to find anything on the apa tu, on the palm and the ni?
I would expect to find.
What do you expect to find or not? When you listen to this, do you expect to find anything on the palm and on the feet?
I expect that there will be redness and swelling of the hands and feet, and
Ada tak
also
dalam
this.
history Aminah?
Sorry, what?
Is there any history or not about the palm and the feet finding? Complaint on the palm of the feet?
It mentions that there is edema and desquamation.
Mina, I don't say stupid to you. I'm talking about history.
Oh, sorry. The mother noticed that there was swelling of both the hands and the feet, and also peeling of the skin on the right thumb.
On the right thumb?
Thumb, yeah.
On the history?
Yeah, yes.
Then what you expect to find?
Desquamation or peeling of the right thumb.
Lagi?
Bilateral hand and feet swelling.
Okay. Anything else you want to find, Hanis?
He seems paler.
Pardon?
He seems paler. Pale.
Pardon?
He seems pale.
The patient is
Pale.
pale. Why you think patient have gone to be pale?
Because dehydration status.
Dehydration status, when I'm finding dehydration patient is pale.
No, for the dehydration status, he seems lethargy.
Pardon?
For dehydration status, he seems lethargy and irritable.
You think that is due to dehydration or due to Kawasaki? If you want to know about dehydration of the patient, what the thing you're going to ask about? Something that not related with Kawasaki. Shamima.
Yes, doctor.
You want to know dehydration, how bad dehydrated the child is. something you want to know about the hereditary child. The child is poor oral intake, also diarrhea. We don't know the history of diarrhea, how bad the diarrhea is. What the thing can help you to decide that how bad the dehydration the child is?
We can see either the patient had sunken eyes.
Yeah, okay. If mom complain if the child got sunken eyes lagi,
any sunken at the anterior fontanelle.
budak ni ada fontanelle lagi ke?
No. Either there is increased interest, you can ask the mother, either the patient increased interest.
Ada dan increase interest apa lagi?
The mucous membrane, either it is dry or normal.
Not all mother can know that. Can notice that.
The urine output either.
Urine output. You can ask the mother urine output. So tanya Aminah, how do you urine output of this case?
No,
Either it
there's
is
no change. There's
No
no change
change.
in
No?
frequency.
Pardon?
No change in frequency or yeah.
No change in frequency. But would frequency tell you about the volume or the color?
No change in the color. Volume is not mentioned.
So Anis, why you mentioned pale just now?
Because he has dry lips, so I expect that because he has dry lips.
Dry lip atau pale? It's better patient is pale. Is there any reason for the child to become anemia?
No.
Unless you tell me there is something, a reason why the child should become anemic. Anis, tell me what investigation you want to send.
Full blood count.
Lagi?
To see.
Just tell me the investigation you want to send. Full blood count lagi?
And then urinalysis.
Why you want to send urine analysis? Sebab keluar kat mulut. Itu je. Apa terlintas keluar otak itu yang keluar. Kan? Tambah duduk dan fikir dulu why you want to say those things. Okay, why you want to send urine analysis?
To see the electrolyte.
Urine analysis, you want to see the electrolyte?
Sorry, that's
I asked you want to send urine analysis. Why you want to send urine analysis?
I think I'm confused with renal profile.
So otak you fikir lain, mulut keluar lain. Tak synchronize. You tinggi about renal profile, tapi mulut you keluar urine analysis. Is it like that?
Yes.
Bahaya tu, tahu tak? Dalam exam bahaya tu. Very dangerous in exam. You fikir lain, keluar kat mulut lain. You kena train you punya mulut tu, follow apa yang keluar daripada dalam you punya mind. Very dangerous. So you think on number 5. Anything else? Dua je. Tu year 1, year 2 the answer tu. Ikhwan?
Yes, CRP, ESR,
lagi
inflammatory markers, and also I would like to order ECG to look for the complication of the Kawasaki disease, which are the echocardiography.
Is anything you want to look in the full blood count or not? That indicate to you, you're dealing with Kawasaki.
Is it platelet count?
What you expect you want to look at the platelet count? Ya betul dah. Tapi platelet count you dapat 1 markah je. Kalau you jawab betul dapat 2 markah.
Thrombocytosis.
Thrombocytosis.
Okay, any other questions? Ada letih dah. You rasa ada letih tak? Siapa yang letih? You all ke I yang letih? You rasa siapa yang letih? Who is more tired? I ke you all?
Letih.
You all tak tired? Tak tired? Kalau you dah prepare waktu malam tadi you baca, you think will become more nicer to discuss or not? Perhaps we can go into the management lalu. Even we can go bit detail. Which day the limb edema, which day going to have a discrimination, which day we have thrombosis, when we expected thrombosis to come, what the criteria, even perhaps kalau you are better, we can go to the atypical Kawasaki some more. Extra thing to learn. Tapi UT all deserve to go to that level tak? Echo little bit more for siapa yang pandai. Kalau echo, what do you want to look at?
For the complications, to look for the complication.
Yeah, what echo? What you want to look at?
Mitral regurgitation.
Look at the coronary artery.
What you want to look at coronary artery?
Your physical morphology. Is there any reason? Coronary artery, any reason?
Dilation of coronary artery. When you consider significant, what is why you worry so much about coronary artery, Dato, aneurysm? So see, nak discuss further tak boleh kan? Because I have principle not to feedback. My principle to teach you all is how to think. The rest you find on your own. That's the way I teach. I'm not going to spoon feed because everything you want, you can find it through your internet. Google dia. Kawasaki coronary artery. Explain to you everything. My job is to explain to you why you worry about the case got Kawasaki. What to look at to look at the child if you suspect the child had Kawasaki, and in this case, what the child do the child have any clinical of aneurysm or not? That's my job. My job to teach you clinical. My job is not to teach you knowledge. Knowledge you can find it. You read every day, right? Kalau you punya internet, buku, apa ECG finding you can found in the. Okay, any question?
I would like to ask, as this patient also present with chesty cough. So if does this patient have any known respiratory disease such as asthmatic?
I don't know. The history is not complete. Cough can be many things. There are possibility because even now I don't know how significant the cough is. I don't know how significant the cough. What you think about the history? You think the cough very significant?
Yes, because the
cough, if you ask me the cough, wet cough or not, the cough is very frequent or not, the cough is started with shortness of breath or not, there's runny nose or not. The charge as coughing, what trigger the coughing become what will make the coughing more severe, night cough or daytime cough, any wheezing with cough. Ada they characterize the cough.
Chesty cough and associated with runny nose.
Okay lah, probably it can explain by URTI. But do URTI related to the Kawasaki? And the second thing is that what the chief complaint of this case?
Fever.
You think the chief complaint of this case just fever only? You think the mom worry about the fever or about the tongue, or mom worry about the edema or the swollen of the knee? I don't know. Even chief complaint in this case also, I have to check if I will be there. Because why the thing that the mom concerned so much? Even the symptom when the child admitted to Rompin, what the symptom that developed in hospital Rompin, what the symptom developed before they admitted to hospital Rompin? I tak clear.
It was the rashes which caused the mom to bring him to hospital Rompin.
So
she was worried about the rashes.
So the chief complaint will be?
No, but this one is
the
when he
chief
was
complaint
admitted.
is the one that bring the child to the hospital. So what bring the child to the hospital?
Hospital Rompin is when he developed rashes. After that, he returned back home and then he had vomiting and diarrhea. And then again, the mother brought him to Klinik Kesihatan. And from there, they referred him to Pekan.
So he bring because of what? So okay, why they come to the hospital? There are two problems. One is hospital Rompin. Is it Rompin? Yeah. Okay, the next question is patient went to the hospital Pekan. Is it?
Was referred, yes.
Okay, the patient went to hospital Rompin first.
Yes.
Then go back home.
Yes.
Sent home. Then he went to the KK. True or not?
Yes,
from KK, KK sent to the
hospital
Pekan.
Pekan.
So where the chief complaint is?
Hospital Pekan.
So the chief complaint is why the patient was sent, the patient KK referred to hospital Pekan, true or not?
Yes.
Is it?
Because of suspecting Kawasaki disease, yeah. But
yes, but why the child going to Pekan to the KK?
Because of the persisting symptoms, like the fever was still there, the rashes
Lagi?
were still there, and additionally vomiting and diarrhea.
So the chief complaint will be fever for 6 days, rash for berapa hari?
3 days.
3 days,
No, 2 days.
2 days.
2 days. Yeah.
And then diarrhea vomiting for
1 day.
1 day.
So I can put all that in the
That's the
chief
reason
complaint.
the child was being to the hospital, to the pekan, to the KK. The KK refer to the pekan because based on the fever and rash, and when they examined the child, they noted the child having the swollen
Conjunctivitis and
conjunctivitis and
edema.
rash.
Yeah.
Okay.
So is it okay if I have more than one symptom in the chief complaint, doctor?
The chief complaints or chief complaint.
Oh, okay.
You're 25. If the child is if the child was bring to the kalau mom bring to the hospital to the KK because of fever alone, then the complaint will be fever. If alone, if the child, although there are other signs and symptoms, but the mom bring the child because of the fever, so this complaint will be fever. If the mom bring the child because of the rash, though the child have fever, but the mom don't think the fever is a problem, but the rash is a problem. Though the child have the rash, but the chief complaint will be, though the child had a fever, the chief complaint will be the
complaint will be rash.
Because at the end of the day, is the chief complaint is why the child was brought to see a doctor. What the complaint of? One complaint, two complaint. You have to identify when you collect the case. You have to identify why. What is the cause of the child got this case? The child got so many symptoms. Runny nose, cough, those things, got all the symptoms. But would they all that include a chief complaint? Usually none. Usually patient, usually if got many symptoms, the mom only bring to see you because 1 or 2 symptoms only. That's the chief complaints. But do the chief complaints will become the things that you make to diagnose the case? You know, that doesn't mean that always, because the thing that make diagnose of the case is the conjunctivitis, strawberry tongue, next swollen, the neck swollen, the lymph fatty, swollen of the hand. But that one is not a chief. The mother didn't put it as chief complaint. But when you found that is the symptoms that you make your diagnosis. But if the mom complain about the red tongue, bring that child to the hospital because tongue is red, so that become a chief complaint. But it's a surprise to me the mom didn't worry about the swollen of the hand, because usually
that occurred on the day of admission to hospital Pakan, so he was already going to the hospital anyway.
Admitted, not admitted.
When
the swollen of the hand is during the admission or before, after admission or before admission?
I'm not sure exactly when, but I know it's on the day of admission.
Because the history HOPR is only until the day of admission. After that, it's not anymore HOPI. It is the progress in the ward. Unless the child was transferred to HTEA, So the HOPI is until the day of admission to HTAA. What happened in the HTA will be the progress in the ward, not HOPI. Any questions? Okay, finish.
Okay, so the second case,
What?
nak present ke tak payah
Yalah untuk esok lah.
Memang tak payah, memang tak nak pun. Okay.
Untuk Dr. Taufik pula.
Jap. Nak present ke? Cacah lah recording.
Tak payah.
Okay. So, habis lah.
Okay. Thank you guys.